Welcome to the Breech Birth Podcast. I'm Sasha Hopkins, private midwife, breech birth educator, and your host. This is a space to hear the real, raw, and powerful stories of women who have experienced breech birth in all its layers. Each episode features honest conversations with women who've experienced breech firsthand, offering insight and reflection. This podcast was born from the knowing that these stories need to be heard, to inform, connect, and reclaim the story of breech birth. Whether you're navigating breech birth yourself, supporting others, or simply curious, welcome and thank you.
Hi, Izzy. Welcome to the podcast.
Thank you. I am so excited to be here today.
So we want to give our listeners a bit of context before you jump into your story. Can you tell us how many weeks were you when you had your baby?
Yeah, I was 40 weeks plus 2 days.
Beautiful. And what location are you?
I'm up in far north Queensland in sunny Cairns.
Beautiful. In Australia, for those who are listening outside of there. And what sort of care did you receive?
I was MGP, so midwifery group practice in the public system.
Amazing. And did you have a vaginal birth or a cesarean?
I had a vaginal birth.
Beautiful. Do you want to share a little bit about yourself so the listeners have an idea of who you are?
Yeah, so I'm Izzy. I'm originally from the UK, but I've been in Australia about 7 years now. Career-wise, I'm a speech pathologist. I work with littlies. Love far north Queensland, quite outdoorsy, so it's perfect for us up here. Lots of hikes and beautiful swim spots and places to check out. So yeah.
It is a very beautiful location. I love it up there.
Yeah.
Awesome. And is your breech baby your one and only, or have you got other children?
She's my one and only.
Amazing. Awesome. So do you want to go into your story, maybe just start from the beginning? Was it a planned pregnancy? What did that journey look like? Had you had an idea of what sort of care you wanted before pregnancy, or was that something you discovered as you went?
Yeah, definitely. Firstly, I just want to say thank you so much for doing this. I think this is such a needed resource, and I'm so grateful that you're pulling this together because it will be so wonderful for women that need to access it.
Thank you.
In terms of my pregnancy and planning for pregnancy, it was a planned pregnancy. So I kind of came off birth control about a year prior, which really helped me to learn about my cycle when we were trying to conceive. I do have a condition called ankylosing spondylitis, which is an inflammatory autoimmune condition. And as part of that, I have to give myself regular injections. They're called biologic injections. So it's just a shot that I do in my thigh. Because of that, we had to plan a little bit for the pregnancy because I needed to come off the current medication that I was on and go on one that was safer during pregnancy and breastfeeding. So we kind of started those conversations. I think I came off my biologic about 10 months before we fell pregnant. So a little bit before. Yeah.
And so you fell pregnant. And
Yeah.
did you go to your GP? Did you yourself refer to the hospital?
So I knew before I fell pregnant what I wanted my model of care to be. I've always been very interested in birth, and I knew that I wanted to go for midwifery group practice for continuity of care. So I self-referred myself. I literally called them the morning I peed on the stick, and there was a very faint line, and it was like 2 days before my period was even due.
Wow.
I rang them and was like, please, can I have a spot? And I think the poor lady on the phone must have just been like, this crazy lady, but I got in. So I was thrilled. And my midwife was incredible. The first meeting I had with her, I felt instantly safe and really supported. And throughout the pregnancy, we just had these beautiful long appointments. They kind of felt like chats with a friend more than a medical appointment. And it was such a lovely experience. So I had a really smooth pregnancy overall. I was so lucky. I stayed super active. So I'm quite an active person. Before I fell pregnant, I was like gymming 5 days a week and running lots. And I continued gymming and running and doing everything that I loved. I just kind of toned down the intensity as the pregnancy progressed, and my body kind of needed me to tone it down. So I listened to my body in that. There were couple of kind of minor challenges, like things like heartburn, low iron. I got in my first and my third trimester, I had these funny periods where I just felt super lightheaded, and sometimes I'd have to sit down or lie down because I'd be scared of fainting. Occasional mild nausea that kind of comes with pregnancy.
Yeah.
I did do lots of education when I was pregnant, and I've always had a really high interest in pregnancy. So I think that kind of helped because I've been interested in it for years in birth. And I'd love to share some of the resources that I found really helpful. So I loved the book. It's by Sophie Walker and Jodie Wilson, and it's called The Complete Australian Guide to Pregnancy and Birth. I found that book was amazing. I also read Gigi Sundon's Birth Skills and Ina May Gaskin's Guide to Childbirth, and I loved all of those books. I also read a couple of postpartum resources. So I read a book called The Motherhood, and it's a collection of letters that women have written back to themselves in that early postpartum period.
Nice.
It is so powerful, and not all the stories are positive. Some of them are just really raw and emotional, but it is such a beautiful collection of stories. And I think it really helped me prepare for postpartum and kind of open my eyes to the range of experiences that women can have. And I found that book immensely powerful. I think I cried pretty much every story I read. So I also read a great book called Breastfeeding and the Fourth Trimester. It's by an English IBCLC, so lactation consultant called Lucy Webber. And I loved that book. It was really helpful in helping me kind of prepare for breastfeeding, which is something I was really keen to do, and just kind of helping me to understand what breastfeeding might look like and different experiences. So that book was fantastic. And then The Discontented Little Baby book as well by Dr. Pamela Douglas. It was amazing. I didn't read it while I was pregnant. I read it when I was a couple of weeks postpartum, and it just gave me such permission to follow my baby's cues. And she talks a lot about cued care and following your baby, and it doesn't kind of prescribe any schedule. It's all about kind of sleep, feeding, and crying are the kind of three things that she talks around in the book. And I think as a first-time parent, it is just so affirming in that just do what feels right for you and follow your child's lead, and you don't need to worry about any schedule, and it's all evidence-based, which is amazing. So she really backs it up with the research. So I loved that book as well. I just found it was, fantastic.
Yeah, great. Awesome.
Yeah. So my partner and I booked an active birth class for him. He's a tradie and he likes having a practical job. And I'd heard lots of birth stories where partners of first-time parents, they maybe weren't sure what to expect in birth or in labor, and sometimes felt a little bit lost in how to support their partner, and that maybe wasn't such a positive experience for them. So I booked that birth class to try and give him some strategies to take into labor with us, which was really useful. And we also did the hospital birth classes, which actually I was so impressed by them. The midwife that ran, so pro low intervention birth. The first couple of sessions, she was talking all about what normal physiological birth looks like, and lots of pain management strategies that weren't medicalized pain management strategies. And she was just so beautiful. They were awesome. Yeah.
It's good to hear.
Yeah, it really is.
And so with your appointments, because you had the MGP midwife, did she come see you in your home, or were they all on a clinic setting?
Yeah, we did the first one in the hospital, and then all of them were at home. So I was kind of sitting on my couch having a chat, which was so nice.
Lovely. And at what point did you discover that baby was Breech?
Yeah. So at about 20 weeks, I had a small bleed and we went in just to be monitored, but there were no concerns. I'd been for a run that morning and the doctor thought that it was just my cervix being a bit more vascular and rubbing. So that happened at 20 weeks. At 28 weeks, and this is the point where I think she turned Breech, her movements completely changed. So before I was feeling all the kicks up in my ribs and like her abdomen, and I just couldn't feel. I was actually funny. We'd bought a rocking chair for her nursery, and I was sitting in the rocking chair, and I felt a big movement as if like the baby turned or something. And after that, I never felt kicks high up again, and I could barely feel those movements at that point because she was still so small. And I was feeling everything really low down, like in my cervix. We went in for monitoring. when I felt those movements change, and the baby was fine. But I think that is when she turned at 28 weeks. At 32 weeks, we went in for a growth scan. Bump was a little bit small. It tracked along, it grew by the percentage that it should have grown by every week, but it was just that little bit under. I think it was like 1 centimeter under what they look for. So they offered us a growth scan, and at that scan, she was breech. And even though I knew that I had heaps of time for her to turn, I definitely panicked. And I went home and I started doing all of the things to try and turn her. I was on spinning babies. I was doing all the exercises nightly. I had this nightly routine that took me like an hour to do all the spinning babies exercises while we watched TV. I was doing handstands in the pool. A little bit later on, I tried moxibustion. I did everything. We had a second growth scan at 35 weeks. And that confirmed that she was still breech. I hadn't felt her movements change. So I kind of had a feeling when we were going in for that she was still going to be breech. I did actually try to decline that second growth scan because I felt like my bump was tracking along. So my fundal height was increasing with the percentage that it should be each week. It was just consistently that kind of 1 centimeter under. And I'd read that additional growth scans or additional scans in the third trimester don't necessarily improve outcomes if there's no medical reason, but they can increase the risk of interventions. So
from 36, 37 weeks, they're not as accurate as well because it's harder to measure baby at that point. Yeah. So it's more well-being looking at blood flow and fluid around baby.
Yeah, the sonographer did say that, and I had read that as well. So I tried to decline it, but the doctors basically said if I didn't have the scan, then I wouldn't be able to birth in the birth centre. So I ended up going in for it in the end.
Even if babies breech anyway, they still would let you birth in the birth centre?
They didn't, no.
Right.
But at that point, I think everyone was sort of hoping baby would still turn.
Yeah, gotcha.
Yes. We did also do 2 ECVs.
How was that experience? Do you want to talk through that just for women listening, trying to work out if that's something they want? What did that look and feel like for you?
Yep. So I rocked up and they took me into an assessment room. And it was lovely. My MGP midwife actually joined me for the first one, which was so lovely to have her there. I think she was literally just there for moral support because it's something the doctors kind of run. So she met me there, and then the doctors came in, and it was 2 doctors, and I was lying on the bed. They give you an injection beforehand just into your thigh to try and relax your abdominal muscles, and they push on your belly to try and turn the baby. They try and lift the baby up out of the pelvis, which for me was probably the sorest part. And I was bruised after the first ECV. It was pretty sore for a good week or so after. And they just try and turn the baby with force, essentially, by pushing on your belly. It's not comfortable. The first ECV, I was just trying to breathe through. The second ECV, I actually requested to use the gas because I felt like it might help me relax my abdominal muscles.
Yeah.
Because I was quite active before I fell pregnant, and I felt like I felt like there was still tension there when they were pushing on my belly. And I thought maybe if I can relax those muscles, it might be more successful, but it wasn't. And
how many weeks were you for the first one and then for the second one? What was
I
the
was
time frame?
36 for the first one and 37 for the second one.
Okay. So just a week between.
Yeah, just a week between. We had an appointment in the antenatal clinic between those 2 appointments. For the second one, baby actually kicked the obstetrician really hard when they were trying to turn her. We didn't know it was a girl at the time. So she kicked the obstetrician really hard when they were trying to turn her. And I left that ECV and I thought to myself, I bet she did a poo when they were trying to turn her then. I don't know. I just had this overwhelming sense that she had done a poo and that had scared her a little bit, which I'll come back to later because it's important in the story. So I guess then sort of knew that we were going to have a breech birth. And to be honest, as soon as I found the baby was breech, I kind of dived headfirst into breech education and got a little bit obsessed with it. I was just trying to source anything and everything that I could about vaginal breech births. And I wrote this whole risk-benefit analysis using the BRAIN acronym. Yeah.
Amazing.
Which I then took to the medical appointments to show the doctors, because I knew that if I was to go in with nothing, I would forget everything that I wanted to say and I wouldn't be able to advocate for myself well in that moment. And I knew that I was really well informed, but I'm not a very confrontational person. And I felt that without something to refer to or give them to say, hey, look, I've actually really done my research here,
Yeah.
I wouldn't be able to advocate in that moment
Mm.
well.
Yeah. How was their response to it?
It was taken really well, actually. I
Great.
was surprised, but I kind of had a good chat with two of the obstetricians in the hospital. One was after the second ECV, and I was a little bit emotional. And the obstetrician, she sat down and she read through it and she said to me, look, this is the data that we would use. It's very reasonable. I can see you've really put a lot of thought into this. And I asked her a few questions. I asked about some of the things that I was a bit worried about if we did have a breech vaginal birth, and she answered them really matter of factly. And I just said to her, look, I've made my decision. I want to try for it. And she just said, okay. And then the second obstetrician that we had that chat with was at the antenatal clinic. And she was incredible. She was so woman centric, and she read through everything and was like, yeah. And she said to me when I was leaving, we had to sign paperwork in that appointment to say that we were aware of the risks and it wasn't the hospital's recommendation. So we signed that paperwork. And she said to me as we were leaving, I'm on shift on Friday. If you go into labour on Friday, it would be an absolute honour to support you. And I just left feeling like so positive that actually the doctors really were willing to support me. I think the registrars were more nervous. A lot of the registrars that I had contact with, there seemed to be a lot more fear and a lot more scarier language used. But I think the obstetricians, when they could see that I'd done and put a lot of time and effort into the reading and the research and pulled those things together, they knew that there was nothing that they could tell me that I hadn't already considered.
Yeah. And you'd made an informed decision. You already knew all the information, and that was still the choice you were making.
Absolutely. Yeah. And I think for us, there were things that came into it that were individual. So like with my ankylosing spondylitis, the immunosuppressant injections that I give myself, I actually went into remission in pregnancy. So I didn't need to use the injections in pregnancy, which can happen because the immune system's kind of distracted, right? It's making a baby. So I went into remission in pregnancy. The injections are immunosuppressant, and you can't use immunosuppressants after you've had surgery because of the risk of infection. And I knew that there is an increased likelihood of having a flare up postpartum. And a lot of women do experience flare ups postpartum. And I was very aware that if I was to have an arthritis flare up, I had a newborn, I was trying to recover from surgery, and I wasn't able to take my medication, then that could potentially be a really difficult situation and scary situation for me to be in. So that was something that really kind of played into it. Yeah.
So you went out of that appointment feeling pretty confident that you were going to be supported. What did those weeks, days look like after? Did you continue to try and flip baby, or did you kind of get to a point of this is what it is?
I think after the second ECV, I felt like baby was in that position for a reason. And I just kind of surrendered to it at that point. And I thought, you know what, clearly they need to be in that position for some reason. And I stopped doing all the things to try and turn baby. I carried on doing some of the spinning baby stuff, but I was doing it at the optimal fetal positioning. I wasn't doing it to try and turn them off.
And how was your midwife? How was she feeling about it all?
I think she was excited for me to make a decision that felt right for me. And at the very start, when we found out that the baby was breech at 32 weeks, it would have been at that first growth scan, I was having a chat with her after, and she kind of said to me, look, they've got heaps of time to turn, but if they are still breech, would you try for a breech vaginal birth, or would you go for a cesarean? And I'd heard a lot of stories about how hard it is in the public system in Australia to have a breech vaginal birth. And I kind of said to her, is that something that I can do? And she said, it's your body, it's your baby. You can do whatever you want as long as you're making an informed choice, and you can do what feels right for you. And I felt from that moment that whatever I decided to do, she would definitely support me. And I felt extremely well supported by her and all the midwives in the MGP that looked after me.
Yeah, great.
Yeah. The other thing to say was that at that appointment with the doctor, I did agree to book a backup cesarean at 41 weeks. And I kind of wish that I hadn't booked it for that 41-week mark and we'd booked it for 42 weeks, because it did kind of hang over my head in those last weeks of pregnancy. But I think at that point I was so tired of having all these discussions around safety and trying to advocate for myself that I just kind of went, yeah, 41 weeks, because I knew that that was what they wanted to hear. And I didn't want to have another discussion about declining hospital recommendations. So we did book that in.
Would you have gone through with it if you got to that point, do you think?
I would have gone through with it at 42 weeks. And I actually had a
42.
chat. Yeah, yeah. I had a chat with my midwife. So I was 40 plus 2 and I had a midwifery appointment. We actually had a meet the midwife session before. So it's something that they do with the team if people are on leave. My midwife was going on leave that weekend. So she was away for the whole weekend. So I went to meet the team. And as I was 40 plus 2, there was a high possibility that I could go into labour that weekend. And I had a chat with her about it, and I was feeling really angsty. I was full of like anxious energy that day. And I'd actually got up and I'd gone for this huge walk. I'd walked like 11 kilometers by myself
Wow.
before this appointment, which I don't know what I was thinking. But
It's going to walk the baby out.
yeah, I think that's what I was thinking actually. I said to her, I said, I'm feeling so anxious about the cesarean. I really don't want to do it at 41 weeks. And I think she had seen this coming. I think she knew when I said yes to the cesarean that I was going to want to push it back to the 42-week mark. And I think had it got to the 42 weeks, I would have definitely gone in and done it then. But I just wanted to give my body that extra little bit of time and the baby a little bit of extra time. And I felt so strongly that I wanted my baby to choose their birthday and I wanted them to come when they were developmentally ready. I didn't want to choose when they would come. I wanted that to be their choice. So I had that chat with my midwife. She was really supportive. She said, if it gets to Monday and she's back from leave, we can have a chat with the doctors at the hospital and we can push it back if that's what you want to do. They probably will want to have another chat about declining medical recommendations. But if that is what you're feeling is right for you, then that's something absolutely we can do. And she was so supportive. And I just left that appointment feeling like a huge weight had lifted. I felt so much more relaxed than I had. And I actually thought, leaving that appointment, I bet I go into labour now because I just feel so much more relaxed. And I just went home and I popped something on Netflix, and I hadn't done it in weeks. I just lay on the couch and watched Netflix and just did nothing for the rest of the day. My partner came home and I was like, I feel so much better, because before I'd just been so anxious and talking about this cesarean and teary. And he came home and I was like, oh, I feel so much better. So we went to bed that night, and I was doing the spinning babies side lying release on the bed. And I just went to go to roll over and I felt this big gush of water kind of come out of me. And I was like, ah. And my first thought was, what is that? And then I was like, it's my waters. I know my waters are broken. And I said to my partner, I think my waters have just broken. And I stood up and there was water just gushing. So I popped in a pad, I put on my period undies, and I mean, the pad was soaked within about 2 seconds.
Yeah.
And my partner, I was walking around the apartment and he was coming after me with the mop to kind of mop up all this amniotic fluid that was everywhere. It was
great.
just ridiculous. I checked it at first and I just kind of looked at my fingers and I was like, oh, that looks clear. And then I went to go change the pad and it was straw coloured. And I thought back in that moment, I thought back to that second ECV. And I just thought, I knew it. I knew the baby did a poo then, but I rang the midwife. And because my midwife was on leave, it was diverted to one of the other MGP midwives. And she answered, and I just said, my waters are broken. I haven't had any contractions yet, but there's mech in the waters. So there's poo in the waters. And I think we both were like, no, there's mech. Because I knew that it would make it harder to have a vaginal birth. And I knew that when I went into the hospital, again, they'd be recommending that I go for a cesarean because of the presence of mech. But I also knew that my baby's movements had been really good. As soon as I saw it, I felt so strongly that it had happened at that second ECV. Anyway, so she suggested to me, as there's mech, we're going to have to go in. Will you meet me at the hospital? So I said, yeah, that's fine. I didn't really want to go in because I wanted to wait and just see would things start at home. I knew that the hospital wasn't really a conducive environment to get all that oxytocin flowing and all those lovely hormones that you want to bring on labour. But I said, yeah, that's okay. So we went in and they did some monitoring of me. He hooked me up to the CTG and monitored baby. Baby's movements were really good. And they also had a chat with me. Said obviously the recommendation is that you could go for a cesarean because we can't induce, and this is what we'd normally offer an induction of at this point if a woman has had her waters broken and hasn't had contractions starting.
Did they give you a reason why they couldn't induce just because the breech position? Like, what's the reasoning? Did they say?
They didn't really say, but I think it was because breech is also already a higher risk presentation. And with an induction, that then increases the risk of other things. So I think that was why, but nobody really kind of sat me down and went, these are the reasons for it. And I actually didn't ask because I really didn't want an induction either.
Yeah, so just for women listening, if your waters break and this statement, because I've done other interviews where women were offered induction. So it seems to be dependent on the hospital, not necessarily evidence, because you'd think that would all come under the same umbrella. So just knowing that you can ask, what's the risk? And I know the wording that often gets used, oh, it's higher risk. Okay, well, what is that? Please define that. What is the actual stats? What's the relative risk? Get more information so that you can actually make an informed decision.
Definitely. Something that I did ask for the stats on was premature rupture of membranes, because the doctor kind of said to me, oh, well, the risk doubles every 24 hours. And I said to her, well, what is the risk? And she said, oh, well, it doubles. And I said, no, I understand it doubles, but I was just
What's
hoping
the number?
to get the numbers. And she went out and she printed out the numbers for me and gave them to me, but she didn't know them off the top of her head. So I guess that's a bit of a lesson as well. Yeah. So I forgot to say, but on the way to the hospital, when we were going in for that monitoring, I did experience a couple of very light contractions. They were kind of like 3 to 4 minutes apart, and they were kind of like 40 to 20 seconds. They were really irregular. They were very light, but I was kind of hoping maybe something is starting up. We got there and they could see the contractions on the CTG, but they were really light, and they monitored me for a little while. And I had a chat with the MGP midwife, and she was actually pregnant at the time. And she kind of said to me, look, I don't know what I would do if I were in your position. I would definitely want to have a vaginal breech birth if it were me. And I had asked her, what should I do? And she said, I really don't know if I would self-discharge and go home, or if I would stay, or if I would opt for the cesarean. And she kind of said, whatever you decide to do is the right decision for you. So we decided at that point to stay in for monitoring. And I think a lot of that was more to kind of placate the doctors and give them peace of mind. I did want to check that the baby was well as well because of the meconium. And even though I had that really strong sense that it had happened at the second ECV, I was still keen to make sure that they were okay. I knew that there's not amazing evidence for CTG, but it was kind of the best option we had. And I was monitoring the baby's movements really well. So we stayed in overnight. My contractions died off pretty much as soon as I lay down in the hospital bed to go to sleep. So I didn't have any all night. Something that we did have actually was my blood pressure was a little bit high. Well, the second number, the diastolic number, was borderline. It was about 90. So sometimes it would come back around 89. Sometimes it would be about 93. And it was just sitting at that. So they ended up giving me some blood pressure medication, and that brought it down straight away. I felt fine the whole time. I didn't feel any different, but they recommended that, and I was happy to take that blood pressure medication. So in the morning, I spoke to the midwife that was on. I'd said, oh, I've been feeling baby moving all night. And she was like, baby looks great. She was saying, we were all looking at baby they've got a central monitoring system for the CTG. And she said, we were all looking at your CTG and it's the happiest baby. I felt reassured by that, but I also felt reassured that the doctors would feel reassured by that, if that makes sense.
Yeah.
I was also really conscious that we were kind of on the clock. I didn't really want to go over that 38-hour mark with the premature rupture of membranes because of the risk of infection. Me and my partner had a chat and we decided
Prolonged rupture of membrane.
Prolonged.
But when you said that before, I was like, oh, but why were you talking about that? You weren't premature. But yeah, I get what you mean. Yeah, prolonged.
Okay, yeah.
So premature means the waters have ruptured before 37 weeks, whereas prolonged is an extended time.
That makes sense. I wish they had a different acronym for the two of them.
I know. Well, when it's premature and prolonged, you've got PPROM is what it gets shortened into. You've got double Ps.
Yeah. Okay. Yeah. That's very confusing. That makes sense. Yeah. So I didn't want to go above that 38-hour mark because of the infection risk. So my partner and I, we had a chat and we decided to self-discharge and go home. And I just really wanted to have a shower, have a bit of a rest, feel a bit more human. You always feel a bit yucky when you're in a hospital, especially if you're there overnight in a not very comfy bed. We called the midwives and the registrar came in. I think they saw it coming. The midwife definitely saw it coming, but I think the doctor saw it coming as well. She'd been on the night before and I'd been talking about going home and weighing up that decision. And I just said, look, baby's really happy. I feel confident. I just really want to go home, get ourselves together. If I stay in hospital, I'm going to have a cesarean because there's no way that my body is going to go into labor in this environment. We're on the clock. The only chance I think I really have is to go home and see if it starts naturally. And if it doesn't, I'll come back in for a cesarean. They were surprisingly supportive. I signed the discharge at own risk paperwork, which is never nice, but I felt confident that I was making the right decision in that moment. And we agreed that I would take a thermometer home and I would monitor my temperature every 2 hours. If I had a temperature spike, then I'd go back in because that could be a sign of an infection. And I also agreed to represent that evening, regardless of whether labour had started or not, because they wanted to do a welfare check. So we went home with that plan and I felt happy with that plan. See, we got home. I had a really long, hot, beautiful shower. I washed my hair. I felt human again. My partner, he made a lovely breakfast and then we had a little nap because we were both so tired from the night in the hospital. Then I got up and I decided to bake a birthday cake for the baby because I knew that they'd be coming really soon. So I put on really nice music and just kind of danced around the kitchen baking this cake. We went for a little walk together and then we came home and my partner lit a load of candles and we just laid down in bed together and we were just kind of lying there chatting, relaxing, and it was about 6 p.m. and I began to feel the very kind of first light tightenings again. I had texted the MGP midwife earlier that day, but I knew she had plans all day. So I knew she was busy that day. So I wasn't concerned when she didn't reply. But at 7 p.m, I called her phone and it diverted to another MGP midwife who was on call. And it was actually amazing because she had done a lot of additional training in breech delivery. So she's worked previously as a home birth midwife and in home birth in the public hospital system as well. And she had done a lot of training on breech. She did tell me that the assessment centre had been trying to ring me all day, but my phone had been on Do Not Disturb. So I hadn't seen their calls.
Probably for the best, so you could actually relax.
Exactly. And that's what I said to my partner when I put my phone on Do Not Disturb. I'm just not going to look at my phone all day, and we're just going to have a day, us two. And regardless of what happens, if I go for a cesarean or if labour does start naturally, we're going to have a really nice day, and we're going to get prepared and in the headspace to welcome this baby. So I said to her that I've been checking my temperature every 2 hours, and it had consistently been at like 36.5. Didn't have a temperature. I'd felt really strong movements all day. So I felt pretty confident that the baby was well. The movements were really normal. I explained to the midwife that before I made a decision whether I was going to go for a cesarean or whether I was going to go into labour, I wanted to wait until the morning and just see, did labour start naturally? If things hadn't started naturally by the morning, then I was going to be at around that 38-hour mark. And my plan was just to present to the hospital then for a cesarean. And I told her that on the phone. I just said I wanted to give it a chance. So she was really supportive. She said, that sounds like you're being really sensible. You've been monitoring movements. You've been monitoring your temperature. She did encourage me to return to the hospital for a fetal check and just to check my blood pressure, which I didn't really want to do because contractions were just starting, but I thought, well, I did tell them that I would do that. My blood pressure was annoyingly on that borderline cusp again. So we got there, and luckily it was just us and these two beautiful midwives in the assessment centre. They were so lovely. And one of them kind of said to me, I think she was really excited to see a woman kind of doing what felt right for her and her body and advocating for herself. And she said to me, I've had 4 low intervention births and I've declined hospital recommendations in some of my births. She was just really pro us doing what felt right for us and advocating for ourselves. So we went in, and bless them, they tried to make it such a beautiful space because they knew that I was trying to go into labour. So they put on some music and it was just us two. We were chatting to them. And when we got there, she said to me, look, I know that you're probably quite pro low intervention and you've probably looked at the research around CTG. I'll just monitor the baby with the Doppler and listen to them. So she did that. But then when my blood pressure kept coming back a little bit elevated, they did kind of say, look, the doctors are going to want to see a CTG. Do you mind if we pop one on? And at that point, I was like, well, I'm here already. I can stand by the bed and sway and do whatever. Just pop it on. It's fine. So they did that. At that point, things were starting to get a little bit more intense. So I was kind of needing to kind of pause for some of the contractions and breathe a little bit through them, but it was still very, very early. So at 9 p.m., so we were waiting for the doctors to come and see me because of this blood pressure so I could discharge at high risk and go home. I kind of wanted to take that medication again because I was like, well, it worked really well last time. It would just give us a few hours to go home, relax, get into the headspace. But the doctors were all in theatre. Nobody was available to come and see us. So at 9 p.m., they moved me to birth suite. And I said, well, can I just go? The midwife said, well, you can if you want. And I said to my partner, let's give it another 20 minutes, half an hour, and I'll just see if the doctors, because they kept saying, they'll be here really soon, they'll be here really soon. They were still in theatre. So we waited for a while. The doctors didn't come. And it was getting to the point where I was really wanting to pop the TENS machine on. And we'd left everything at home, partly a little bit deliberately, I think, because I knew that it would mean that we could go back home to get everything. Yeah. So we were just waiting for the doctors. Things were slowly kind of intensifying. And I said, I want to go home and put the TENS machine on. So we called the midwife back in. And it was the midwife that had had the 4 low intervention births. And when I said to her, I'm not joking, she ran out of that room to get the paperwork. I think she was excited for us. And as soon as I said to her, yeah, I want to go, she was just like, okay, well, we're doing this. we went home. We got into bed. And my partner, bless him, I'd done so much education with him around birth, and I'd really drilled into him that in early labor, I need to rest and we need to rest because it could be a long time. So help me rest in early labor, and you need to rest in early labor. And we got into bed and I could not lie, just couldn't. I tried the peanut ball. I tried propping myself up on pillows. I was trying all these different positions, and things were intensifying, and it was getting harder and harder to stay still. And I just could not lie, and I could not get in a comfy position. So I kind of said to him after about half an hour, I was like, no, I need to get up. And he was like, but you need to rest. And I was like, no, you don't understand that there's no resting happening here. So we got up and we went into the other room. And I realized at that point that I hadn't felt the baby move in about an hour. And I knew I was rationalizing myself. I was like, I know they're probably sleeping, but I think given everything, given the ruptured membranes, given the blood pressure and everything else, I was just starting to feel a little bit nervous. And I said to him, I think we should go back in. And he was like, are you sure? Because if we go back in this time, we're probably staying. And I was like, yeah, I just want to check that the baby's okay. So we packed all our birth supplies for the final time and we headed back in. And I forgot to call the MGP midwife because I just was not in a headspace where I could think about being on the phone. So we arrived, and because the hospital shut down for the night, we were readmitted through emergency. And the emergency staff were lovely, but this lady was so insistent that I have to be in a wheelchair to be pushed through the hospital. And I was like, I don't want a wheelchair. And she just would not allow me to walk. So I ended up getting in this wheelchair, and I felt so self-conscious being wheeled through the hospital. I actually closed my eyes. I just felt like it was so over dramatic because it was very capable of walking still, and I could just pause and wait. But anyway, we rocked up in this wheelchair, which was, I think, a bit over the top. The midwife on duty at birth suites said, oh, I'll call your MGP midwife. And she just popped us back in the room that we'd been in earlier, which was a kind of smaller birth suite assessment room. So Matthew popped the music on and I had the TENS machine on, and I was leaning over the bed and swaying and getting into the groove of the contractions. Matthew started applying some counter pressure on my lower back to my hips, and that worked really nicely. And the MGP midwife got there. She moved us to a nicer room, which was lovely. We had a big birth suite room with lots of floor space and a bathtub. So we got in there and really got into the groove of things. I was leaning on the bed at this point, leaning over the bed. And with each contraction, I was kind of dropping down into it. And I'd heard so many stories about women using the mantras down and surrender. And those were the two that I really carried with me through my whole labor. They were the two that I used. Down, surrender, and open, actually, I probably used quite a lot as well. I'd heard this lovely quote from a birth story. This woman had written it up on a post-it note and popped it up on her fridge. It said, don't push the river, it flows by itself. And that was something I put it up on my wall as well at home above the kitchen sink. That's something that I really, really consciously tried to take into the experience with me, that my body was capable. And my body could do this, and I just needed to surrender and let it do its job because it would flow by itself. It would do it. So yeah, I was using those kind of mantras with each contraction and really consciously trying to relax down and surrender. So we progressed like that for a bit, and I was squatting in the contractions.
And did you have the CTG monitor on?
Yes, I was about to say that actually. I did. I agreed to it initially. I had declined when I was talking to the doctors. One of the things that I'd written into my analysis was CTG monitoring because I knew about the evidence for it, and I felt like it could increase the risk of unnecessary interventions when I looked at the evidence base. But I was happy to reconsider that because of the meconium, and I knew that the doctors would be incredibly nervous if I was not to have it, basically. So I did have it, and it was actually fine. I think it ended up providing me with a bit of extra reassurance. because there was some fresh meconium during my labor. And when I asked the midwife about it, she explained that with breech babies, because they're bummed down, the abdomen gets squeezed as they kind of go through the pelvis, and fresh mech is something that is seen quite commonly with breech babies. And she also said to me, your baby looks really happy and healthy, and I'm not worried about them because their heart rate is really good. So I think that actually ended up providing me with a bit of extra reassurance, because I was worried when I saw the mech. I think she kind of turned down the sound and just kind of minimized it as much as she could. She had the monitor behind the curtain, and it just wasn't like in the room with the noise loud. It was coming and away from us, so I could get into my groove and labor.
Great.
So at about 2 a.m., she offered me a VE. I didn't have one on admission because I'd only asked for them if the midwife kind of felt there was a medical reason. So at 2 a.m., she offered me a VE, and I was 3 centimeters dilated, but I was fully effaced at that point. And I initially kind of felt like only 3 centimeters, but then I had to think about it. And the night before, when we had discharged that morning, they'd done a speculum to check that there was no cord presenting, and the registrar told us at that point that my cervix was long and closed. And I was like, well, actually, I probably only felt my first real contraction about 7 p.m. and it's 2 a.m. now. So to go from that time frame, that's actually quite quick, I think, for a first labour to progress to 3 centimetres and fully effaced. So I felt a little bit better once I thought of that. And that just gave me a bit more confidence that your body's doing it. And things felt
Great.
like they were intensifying as well. Like I could feel that things were ramping up, and it felt like it was happening quite quickly. I think I just surrendered to it then and was like, it is happening. So I requested to use the gas. And we started really low. And that was really amazing, actually, because every time I had a bit of a crisis of confidence or felt like I needed some additional pain relief, we had so many incremental points where we could turn it up bit by bit, and it just gave me that extra time each time. So that was awesome. I had the bed up, I raised it up as high as possible and was like leaning forward on it for a lot of early labor. And then I kind of got on the birth mat and was leaning over the ball, and that was a position that I'd loved in pregnancy, was kind of just like swaying and leaning on the football. My partner was providing lots of counter pressure to my hips, and there was a point where I had really intense pain in my left hip, and I know it was my left because I get arthritis in my right, and it felt like my arthritis pain. It was hard to wait there on that leg. I was sort of like limping around the room. But when the midwife checked me, she said the baby had quite a lot of rotation still to do. And I think at that point, the baby was just sitting on a funny part of my pelvis. So the midwife came in the room and she watched a contraction, and she could see that I was starting to struggle. And I wasn't using the TENS machine anymore at this point. It was just too intense. I was forgetting to press the button. I was just kind of riding through the contractions. And she looked at us and she was like, what do you need? And I had no idea what I needed in that moment. And I was so glad that I'd done so much education with my partner, because he was like, what about water? And I was like, yeah, great. That sounds like a great idea. But there's no way in that moment I could have thought of that. I was just not in the headspace, and I needed that support person to suggest it for me. And instantly I was like, I want to get in the bath, which I knew wasn't going to be recommended because of the ruptured membranes. So I said to the midwife, I can't get in the bath, can I? And she was like, well, let me go see. I can go ask. She was like, I think they might let you. She did give us the option of the shower, but I didn't think the shower would be that helpful, because it was getting to the point I wanted to feel that weightlessness of being submerged in water. So she came back and she was like, yeah, you can get in the bath. And that was amazing. I think it was like instant relief when I got in, and the weightlessness really helped with the intensity of the contractions. And I just went into this really dreamlike state. I was drifting off to sleep. Between each contraction, I had the gas. I'd have a contraction, I'd wake up, I'd breathe through it. And then as the contraction finished, I'd just kind of drift back off to sleep on the side of the bath. I kind of lost all sense of time. I was in that like very dreamlike, warm oxytocin state. So After, and I only know this from looking at my notes, after about 5 hours, it got to about 6 a.m. and my contractions had started to space out a bit. Midwife came in and she was like, "Do you want to see where you're at? I could do a vaginal exam." And I said, "Yeah, that sounds like it's probably a good idea." And I got out and she was like, "You've made really good progress. Or 6 centimeters, you're fully effaced, but the baby's bum is really, really low." And I think the backup midwife was due to arrive shortly because there was shift change at 8 a.m. So I got it back in the bath and I was in the bath for 2 contractions. And I remember it was 2 contractions because at the first one, I started feeling so much pressure in my bum. And I thought, no, I've just been checked. I'm 6 centimeters. Like, there's no way I'm ready to push yet. And then the second contraction came and it was so intense. And I said to my partner, we're going to have to call her back in because I'm feeling so much pressure in my bum. And I know I'm only 6 centimeters, but it feels like the baby's coming. So she came back in. I got out the bath. I think if I had wanted to stay in, she probably would have tried to kind of advocate for me with the doctors, but I was happy to get out at that point because I just had a sense that the baby wasn't far away. And the position that I'd kind of always envisioned myself birthing in was up on the bed on all fours, leaning over the top of the bed. And I just hopped up onto the bed and got into that position at that point. And my notes say that I was becoming a lot more vocal with contractions. I remember trying to bring the sound down so much because the contraction would start and the sound would intensify and I could feel my pitch rising, and I was really trying to bring it down and do that mooing deep sound to try and relax everything. At about 7 was when I had that initial vaginal exam and I was 6 centimeters. And at about 7:45, the backup midwife arrived, and I think I just got out of the bath at this point. 8 a.m., the midwife had a look as I was having a contraction and she was like, "Izzy, the baby's coming. If you want to put your hand down there, you'll be able to feel the baby's bum." And I put my hand inside my vagina and I felt my baby's bum and it was right there. And that was amazing. And I was like, oh my God, I just couldn't believe. My only thought really in that moment was, I can't believe this is actually happening. And I'm having a vaginal breech birth in the public hospital system. It was just pure disbelief. I think up until that point, I'd really been mentally kind of guarding myself and I was still mentally preparing myself to go for a cesarean. And it wasn't until I felt my baby right there and I was like, oh my God, they are coming.
It's happening.
Yeah. So at about 8:10, I was at full dilation and baby was descending with each contraction. By about 8:30, that I think the baby was visibly, I think it's called rumping, is it? When the bum comes out? It's the cutest thing ever. So the baby was visibly rumping and the backup midwife pressed the staff assist for the pediatric team and the doctors to come in. The doctors came in, but I feel like it's really important to say they didn't deliver the baby. The midwives were the ones who delivered the baby. And
I'm gonna correct you even more and say they caught the baby because you birthed your baby.
You.
No one delivered
Thank
it. You birthed
Thank
it and they
you.
caught it.
Okay, they
Yeah,
caught
you
the
did
baby.
all the work.
Thank you. They caught the baby. They were the ones to catch the baby. I feel like in the hospital system there is a hierarchy. And sometimes doctors have the final say. And I felt so safe in our birth with the care that was provided by the midwives that looked after us. I know that they protected our space as well. I know that doctors probably would have tried to come into the room and they would have protected that space for me. And I did have that in my birth preferences. But I think that was so instrumental in having such a positive birth experience and really allowing me to get into that headspace that I could go into that dreamlike state that really helped intensify my labor so quickly. I think if doctors had been coming into the room or introducing themselves, just any of those interruptions would have really thrown me off and would have brought me back. I needed to be in that state for things to progress how they did.
Yeah. And did you know if baby was frank breech or complete breech?
Yeah, so they had one leg up in a frank breech position at all our scans, and then the other one was bent.
Yeah, so incomplete.
Yes, incomplete. Because one of the doctors told us that they were, is it complete breech?
Is where both knees are bent?
Yeah, one of the doctors told us that the baby was that. And I was like, well, they're not that though, because I've seen the foot up by their head every scan. And I could feel the foot actually. They were always in the same position. Yeah. But when the baby delivered, obviously they were frank as they come through. So everything must have kind of smushed them
So it
up.
ended up being frank at that birth. So the other leg went back up.
Yeah, the other leg went back
Yeah,
up. So I
okay.
think as they'd come through my pelvis, both legs must have raised. But that was the position they were always in when they were inside me. And it was so funny because for weeks after, every time we changed her nappy, one little leg would be up by her head and the other one would be in a...
And did Bud come straight to you after birth for skin to skin?
Yes. Oh, so baby was born and she was handed up to me. And the midwife was prompting me. She just said, like, blow on her face, give her a little hug. And she looked shell shocked, the baby, when she delivered. Her fingers were splayed and her mouth was open. And she was just kind of blinking and looking around like that. Yeah, she looked stunned. So I pulled her up and was just kind of blowing on her face. And she was blinking and she was looking around. And it felt like a very, very short amount of time. I think it was maybe like 10 seconds that I had her there before the pediatric team kind of jumped in and they prompted my partner to cut the cord and they took the baby over to the resus bed. And a big part of me really wonders if we had just given her a little bit more time and let her come to, would she have taken those independent breaths herself? Because I could see that she was looking around and I could see that she was blinking and she was alert. And I just wonder if we'd given her a little bit more time and not jumped in straight away and just had let the cord finish pulsating and all of that stuff, would she have kind of come around herself? Anyway, so they had her over at the resus desk. And I think in that moment, I was so full of adrenaline and just shocked. I still couldn't believe that it had actually happened. And I was in this crazy headspace that I was not in a space where I could advocate for her at all. I wasn't in a space where I could ask questions. So I could hear the medical team kind of discussing medical interventions. And I heard one of them saying starting CPR. And I remember feeling very confused in that moment and feeling like, why are they starting CPR? Because she was just kind of looking around. And so I was feeling really confused, but I wasn't able to advocate in that moment. So they took her out the room to go to the special care nursery and Matthew went with them. The midwife said to me, she was like, oh, baby looked really good. She was doing tummy crunches as she was coming out of you, which is something that we look for good tone in breech deliveries. She didn't really say much about her not breathing independently, but she just reassured me that her tone looked good and the baby looked okay. And I didn't really understand. And actually something that I really still don't understand, I asked my midwife about it, but she wasn't there, so she wasn't really sure, is the APGAR scores they gave her. So they gave her an APGAR score of 1 and 6. And I mean, I'm not trained to give that baby that I saw in front of me could possibly have had an APGAR score of 1 because she was looking around, she was alert, she was blinking. But I really don't understand what happened there, to be honest, because...
Did you ask about doing a debrief with that team, with the pediatric team, or at least the midwife who was present?
I could ask about that with the midwife, actually. I haven't really thought about that, but it is a big question that I still have about the birth.
For future births as well, to have a good understanding, is this something that could happen again, just so that you've got a clear picture of what that looks like? Yeah.
I think that would be a good idea, actually. Maybe I'll ask for that.
Okay, so baby went to nursery, you stayed in the birth suite. How long was baby in nursery for?
So they put her on IV antibiotics and they put her on the glucose drip. So she was nil by mouth. Again,
well, did she have breathing support in there as well, like the CPAP?
She did. Because she had CPR, they put her on CPAP. She was on CPAP for the minimal amount of time. By the time I got to her, once I'd been stitched up and everything, she was breathing independently through her mouth and she wasn't using the CPAP mask, which was over her nose at all. So I still feel very confused about her care
So
after.
when you say CPR, did baby have cardiac compressions?
I don't know because I wasn't there
Okay.
up at the desk.
Because that's what CPR is. That's what I'm wondering. I mean, if they're doing CPR, then yes, that girl probably was one.
I think she did because I heard them say starting CPR. I think the pediatric team were very concerned about mech aspirate. And that
Yep.
was so when the meconium the baby swallows when they're being delivered and it enters the lungs. I think they were very concerned that that was something that had happened, which I wonder if maybe they had a bit of a narrative in their head because definitely when I saw the neonatologist, so he kept trying to come in the room while I was being stitched up, but my legs were in stirrups and my vagina was facing the door and the midwife was stitching me up. And they were beautiful. They really protected that space for me and kept saying, can you come back in a minute because she's not ready. And then I got into the shower once the midwife had finished stitching me up. And while we were in the shower, he came into the room and the midwife was like, guys, I'm really sorry. Can you be quick and come out because the doctor really wants to talk to you before he goes home. So we came out and I think he was probably the only negative interaction that I had in my whole birth experience because I felt like he didn't look at me when he was talking to me. He kind of like looked beyond me and just talked over me. But I definitely wasn't in a headspace where I was able to ask informed questions yet. I remember he asked me at one point, what gestation was she? And I said, I'm 40 weeks plus. I think I was 4 days at that point, but I think I said to him, I'm 40 weeks plus 2 days because I was just so a mad headspace. And he went, oh, well, she's overdue too. And I remember thinking in that moment, well, she's not overdue, but I wasn't able to say it. I just was not in a space where I could advocate for myself. Anyway, I think he was the only negative experience that I would say we really had. And my partner said that when he went with her to special care, that doctor was talking about flying her to the nearest NICU and we'll have to fly her to another hospital before any of the test results came back. So I wonder if they maybe had a narrative in their head about what had happened and how things were going to run. And don't get me wrong, I'm so grateful to the care team and the special care nurses that looked after us were just incredible. We had a really, really positive experience with everyone else in the pediatric team. I think that experience was probably the only kind of negative interaction that I had.
So how long did she end up being in the nursery?
Because she had the IV antibiotics and the glucose drip, they had to keep her in for 3 days. At day 3, we were about to be discharged, but she was starting to look a little bit jaundiced and she had that bruising on her bum as she came through the pelvis. So they wanted to keep her in for another night. So we stayed that night and in the morning they did bloods and she was just under the line for jaundice. And they said to us, look, we'd recommend the phototherapy at this point because if we don't do it here and if you do need it and you go home, then you're going to have to come back into the pediatric ward and get it there. So we said, okay, that's fine. So she did another 24 hours in the NICU. So it was 5 days in total.
All right, so she had lots of things going on.
She did.
How was your breastfeeding amongst all of that? What did that journey look like?
Yeah, good question. I do think that initial nil by mouth definitely affected our breastfeeding journey. When we saw her, we immediately asked to get her out the crib and do skin to skin because I was really conscious that she'd missed out on that initial skin to skin. We did skin to skin that day. I think we were there for about 12 or 14 hours doing, probably longer actually, because we would have got there pretty early in the morning. It was probably more like 14 or 16 hours. And we tag teamed. I would do skin to skin for a couple of hours, then Matthew would do it, then I would do it. We went to bed and I slept for a couple of hours on the ward and I came back after a couple of hours because I just didn't want to be apart from her. And when I put her on my chest then, she just started rooting immediately. So that was amazing
Great.
because we hadn't been rooting the day before. So I think all that skin to skin really did help. Another really positive thing about our special care stay was we did get a lot of feeding support. And I think I saw lactation in the hospital about 4 times when we were in special care. And I came back for a subsequent visit as well after we were discharged. They did tell me that I had insufficient glandular tissue.
Mm-hmm.
And that has definitely affected our feeding journey. I haven't been able to exclusively breastfeed, but she is still getting, I'd say, about 40% of her intake from breast milk. She gets a bit frustrated on the breast because my letdown is so slow, but I'm pumping a lot. And I recently invested in a hands-free pump, and it is the best investment that I have ever made in my life, because when my partner's not at home, I can just do things and I can pump, I can hold her, or whatever I need to do, I can do. So it's amazing.
It's a very big journey, that alone, and having to express on top of feeding. It's a lot of hours focused around feeding and providing food for your baby.
Definitely. And especially in those initial weeks, we were supply lining when we first got home. So we were doing all the top ups via supply line, which is a little tube that you feed into the corner of the baby's mouth when they're on the breast. So we were doing all the top ups via that. And I was expressing after every feed. And it just felt like our whole life, especially when I was having to hold the pump on, was feed, express, sterilize, feed, express, sterilize. And feeds would take such a long time because the supply line is so fiddly. Although if anyone is supply lining, something my partner did, which was pretty life-changing, because usually you need two people and one holds the bottle and moves it up and down. He drilled holes in the tops of the bottle lids so I could just feed the tube through. And then I could hold the bottle, and if it spilled, or it was coming out very slowly. And that really, really helped me do it independently for a little while. I said to my midwife, she came to visit, she was like, I never thought of that. I was like, we just needed a tradie brain to think of it for us.
That's awesome.
Yeah.
And did she need any support postnatally for her body? Like sometimes breech babies can have a bit of a tightness in their necks.
She did. I've been taking her to a chiropractor. So I asked the lactation consultant when we went back to the hospital, and she suggested taking her to a chiropractor. She also favoured turning her head to one side, and she still favours that side. But we've just been trying to pop her on both sides, and we've put the bassinet so when she is facing us, she's on her non-preferred side because she's more likely to turn and face us. Yeah, so we've been seeing the chiropractor. I think it's definitely improving a lot. And she actually had a big lump that you could feel, and the chiropractor said it was a big muscle knot in her neck.
Wow.
And it definitely really evened out. But bless her, it must have been really sore because it was like a real lump, and when you touched it, she'd kind of wince. But it's definitely getting a lot better, which is awesome.
I know, I've definitely seen bubbies who have such tightness that they can't do a lot of movement, and when they go to the chiro or the osteo, they do cry because it is intense, but it does help. It is just very hard for the parents, of course.
Yeah, it is hard, but it definitely is helping her. So yeah.
And sometimes that can affect them latching on the breast too. So it is important to get a little head to toe for your baby. I recommend for head down babies as well. So knowing what you know now and having the experience that you've had, would you do anything differently?
Yeah, I would. I wouldn't go for the ECVs because I know that my body is capable of birthing a breech baby. And it was really a very straightforward labour and birth. And my body just did it, and she just came out how she was meant to. I think if I had a head down baby, I would 100% go through the MGP again, because the care I received was phenomenal and the midwives are just amazing. If I had another breech baby, I would consider doing a home birth, because I think that initial point post birth where she had a lot of interventions, I do wonder whether all of those interventions were required. And I think if I did a home birth, I would feel confident in the midwife supporting me, but also I would know that if she was given interventions, then they were 100% required. Does that make sense?
Yeah, that makes sense. Yeah. And did you feel empowered with the choice that you made, having a vaginal birth?
Absolutely. And I would not change it. If I have another breech baby, I would 100% have another breech vaginal birth. I feel very empowered. And I think it's really supported my mental health in postpartum as well. And something people say is, all that matters is the baby's healthy, or it doesn't matter how the baby gets here. All that matters is that they're healthy. And yes, that is the most important thing, that mum and baby are healthy at the end of the day. But when we talk about health, I think we so often forget that mental health is included in that. And I think my birth experience really allowed me to go into postpartum feeling like I felt really positive. Every time I thought about my birth, I just felt really empowered and really positive, and I felt like we were safe and supported and everything had happened as it should. I just wish that more women had the choice to make the decision that feels right for them if their baby's breech, and they are able to have that same choice that we advocated so much for and were given so beautifully.
Yeah. Yeah, amazing. And you've already shared some amazing resources. Is there any last words of wisdom or advice you'd like to give to anyone listening now who might be expecting a breech baby?
Yeah. Another great resource is the Great Birth Rebellion podcast and the resource folder. So Melanie, she'll email you a link to a resource folder and it has all the publications and studies. I use that, and the evidence-based birth website as well was really useful when I was pulling together the brain discussion and looking at all of the benefits and risks. And even if you're not a confrontational character, I hate confrontation and actively avoid it, you can still advocate for yourself. Even if it's writing something out and bringing it to your antenatal appointments, you can still advocate for yourself in that moment, and don't be afraid to go in with resources and studies. And I think that's all I really want to say.
That's perfect. Thank you so much for coming and sharing your story. I really appreciate your time.
Thank you, Sasha. I'm so glad that you're pulling together this resource, because I was desperate for stories like this when I was pregnant, and I think it will give so many women the confidence to be able to advocate for themselves and achieve a birth experience that feels right for them.
Yeah, absolutely.
Thank you for listening to the Breech Birth podcast. These stories matter. They stretch what we think we know and bring voice to experiences that need to be heard. I'm so grateful to the women who have shared their experiences with us, raw, real, and full of wisdom. If this episode resonated with you, please follow, share, or leave a review. You can find us on Instagram, Facebook, and YouTube at Breech Birth Podcast. And if you have a breech story to share, I'd love to hear from you. Until next time, may we continue to reclaim the narrative, one story at a time.